Well, the human heart is amazing and mythical. When we describe our loved ones, we often say, they're close to my heart. When we want to draw love, we draw a heart. When someone we love hurts us, we say we have a broken heart. Well, right here in Texas, there's a place for all our broken hearts. Not the mythical one, the real one, beating inside your chest. Now, we do want to warn you, the video in this story can be graphic, and it may not be for the faint of heart. Close your eyes, concentrate, and you'll hear the reassuring rhythm of life.
It's just comforting. It's not racing. It's not doing irregular things as my old heart had done.
46-year-old Ernest Jotham has had a long history of heart problems. In 1995, he was living his dream, playing football at TCU, until the day he couldn't breathe.
They had done an EKG and noticed I had an irregular heartbeat, and at that point then they did an x-ray, and my heart was extremely large.
It never got better. Ernest needed a new heart, so the high school tennis coach and father of two underwent a heart transplant. Now, he spends his days doing a unique kind of cardiac rehab called industrial athlete, working his way back to health.
And I go through cardiac rehabilitation, and I'm still getting used to it because it performs differently than my native heart.
As he grows stronger, his curiosity about his old heart was growing as well. So he went back to the Baylor University Medical Center in Dallas to say goodbye to his old, broken heart.
There was one young man who broke down when he saw his heart.
Dr. William Roberts is in charge of the medical center's Heart-to-Heart program. It's here where they let transplant patients visit and spend time looking at and even holding their old heart.
Everybody's basically curious.
Inside his lab's cabinets are dozens of human hearts, once full of life, now gray and yellow, sitting in formaldehyde. Hundreds more are in a large storage facility at the medical center.
This is the right ventricle here.
This all started back in 2014. So far, more than 70 people and their broken hearts have been reunited.
So they bring their spouses, they bring their kids. We've had 15 people in here looking at Daddy's heart.
It's a once-in-a-lifetime chance to look inside your heart.
Now, most institutions do not keep patients' hearts. They're cut, sections are made, and then they're discarded.
But there's a method to Dr. Roberts' heartfelt efforts to teach transplant patients.
I'm a student of heart disease.
When a transplant patient sees their former heart, they also see how their lifestyle choices and eating habits may have helped break it.
And most of us who have problems with our cholesterol levels is the result of what we put in our mouth 21 times a week.
More than 50% of the hearts Dr. Roberts sees are encased in a thick layer of fat.
If you have too much fat, the heart will float in a container of water or formaldehyde.
And so this is another photograph of my heart, and so all this yellow is fat.
For Ernest, it's the moment of truth.
Do you want to see your heart?
Yes, please, sir. Yes, sir.
Why?
I'd like to know why it failed. What was it genetic? What caused it to stop working properly?
Dr. Roberts says there are about 6 million Americans out there right now living with a broken heart in their chest. But less than 1%, only about 2,200, will receive a new heart each year. Many conditions can prompt a heart transplant.
The most common are blockages, and second, idiopathic dilated cardiomyopathy. Idiopathic means we don't know what caused it.
For Ernest, the cause wasn't easy to establish. Doctors only know his heart had to go.
See that cavity? It should get that blood out of there, about 70% of it. And yours gets 10%, 15% now.
Wow.
The smooth outside, the damaged inside. Dr. Roberts and Ernest go over each chamber, every crevice of this broken heart.
There are no scars, there are no portions of the muscle that are dead, but it just doesn't work.
Then, the most unusual of moments. Ernest holds his heart.
I don't know, it's very, I don't know, it's hard to describe as far as words. You know, it is unbelievable. It's unbelievable.
It's a moment Dr. Roberts hopes will change how people take care of themselves and their new heart.
If you get one of these new hearts, you got to change your life, buddy. You've got a responsibility now.
And Ernest says he's truly taking this opportunity for a new life to heart.
To close one chapter and to begin a new one. It's a whole new journey. It's a whole new world.
The Heart to Heart program is the only one of its kind in the country, quite possibly the world, that allows transplant patients to actually hold and examine their old hearts. In fact, we're told some stop by and visit their hearts whenever they're in Dallas. As for Ernest, he's still recovering both physically and emotionally. A heart transplant can cost as much as $1 million, not to mention the time spent off work. So his friend started a GoFundMe page to help him and his daughters with expenses. You'll find it in this story on our website, KVUE.com.